Hello to everyone and welcome to our podcast, Dare to Know Yourself. In this episode, we'll navigate the intricate world of self-harm. We'll explore what self-harm is, its significance, and understanding the emotional connection to psychological pain. We'll also discuss strategies for addressing and treating this phenomenon, along with advice for supporting those affected. And for that, I'm with Dr. Alicia Fraile. She's a psychiatrist here at CNews, and she will help us understand all this. Hello, Alicia.
Hello.
How are you?
I'm fine. Let's just keen on doing this podcast now.
And it's your second one, so you have
This
an
is my
expertise.
second one. Oh, I'm a master.
You do.
No, really, but still. Well, I'll try to my best. I'll try to do my best.
You do it very well. So let's keep on that way. And let's start from the beginning, as we always do. What is self-injury?
Self-injury or self-harm, they are synonymous. It's any harm, any injury that one person inflicts on themselves. Mm-hmm. It is associated with several degrees of suicidal intent. Mm-hmm. But because we think that they are different entities, really, we are just focusing today on non-suicidal self-injury. We are not going to repeat that all the time. So we just say self-injury, but not suicidal.
Okay, perfect.
Right?
So,
by definition. Yeah, so the definition would be any harm inflicted on oneself without suicidal intent, in spite or regardless of the results.
Okay, perfect. In that case, I think it's important to ask you what is not a self-injury then.
Right. By definition, like we just said, any injury produced with a suicidal intent, with the intent to die, that is not the self-injury we are going to talk about today. Also, they are not self-harm. Those culturally culturally positive practices like piercing or tattooing or religious ritual. Let's think of Spanish Easter. Mm-hmm. We all know that when we have been living in Spain. Mm-hmm. Also, accidental injuries, like anyone who cooks, we have cut ourselves sometimes badly.
Yes.
Right? And also, we are not considering the indirect self-injury through behaviors such as smoking, taking drugs, or eating disorders. Mm-hmm. Okay. Right? So those are not self-injury for the purpose of this podcast and in general, as they respond to other motives, other reasons.
Okay, perfect.
Okay.
And why is it important?
Why are they important? Because they are so prevalent.
Okay.
They are all over the place. The figures of the studies are really frightening, at least for me. It says like 17% of teenagers till 17 years old, 13% of young adults between 18 and 24 years old, and 6% of adults from 25 onwards have engaged in self-injury. Wow. So that's a lot. I mean,
that is in Spain or worldwide? Or?
Worldwide.
Okay.
Those are not for Spain.
Okay.
Those figures are worldwide from studies done all over the world, all over the place. So that's a lot.
Yeah.
And also because even if we are saying we are not considering suicidal behaviors here, there is an association. Okay. The studies have estimated that someone who engages in self-injury is 4 times more likely to attempt suicide and 1.5 more likely to suicide.
To commit
So
suicide,
that's important. That's something we should do something about, at least the prevention of suicide.
And in this percentage, which is the predominant profile? Is there an age?
Yeah, the predominant profile is young people, teenagers, adolescent. There are no difference in sex, considering sex as binary, male or female. There are no difference. Some studies yield little predominance of females, but not really significant. There are no difference in race, in ethnicity. We are all the same here. And as we said, all over the world.
Okay, perfect.
Right.
And could you tell us about the risk factors?
Yes, sure. risk factors. First, I want to say,
Okay.
risk factor, to have a risk factor doesn't mean you're going to have that behavior or you're going to have this or whatever.
Okay.
It means it's more likely.
Okay.
But it is not 100%, it will never be, right? So let's start with the ones that cannot be changed, okay? History of self-injury, that is, it seems like obvious, but those who have engaged in the behavior, it's more likely that they repeat it,
Okay.
right? Family dysfunction, parents with psychiatric issues, abuse in your childhood. Those are very, very consistent. Some other, psychopathology, feeling depressed, bad at regulating your emotion, sleep problems, eating disorders, personality disorders from the cluster B. We have 3 clusters. So the B, that is the antisocial, narcissistic, and borderline personality, and histrionic personality disorders. Those are more associated, those are risk factors.
Okay.
Isolation, being victim of even of peers, bullying included, and stressful life events, negative life events. Those are the main risk factors we find.
The main things that we have to bear in mind if we may think about this.
But who is going to self-injure?
Okay, and can you tell us any protective factors then?
Yeah, even if there's not so much research on protective factors, there's much more always on risk factors, but still, protective factors against self-injury, being compassionate about yourself, self-esteem, being kind, feeling a connection with other adults, having other adults or other people, having someone to talk to, feeling supported, those are the protective factors.
Okay.
Being considerate to yourself, being careful, that helps.
Okay. And how do people self-injure?
The most common way is cutting with a sharp object, knives, razors, blades. There is also hitting, also scratching or biting till bleeding, or rubbing the skin against surfaces, but by most common cuts in arms, hands, wrists.
Okay.
And now here there's a little difference between men and women.
Okay.
Women tend to do it more on arms and wrists. And typically they won't do it on the face or breast or genitals. And men, arms is popular for both, thighs as well, sorry, I forgot. But men also tend to do it on the chest and genitals and face, which women. I think we are more clever than that, smarter, so we don't.
So you don't do it there, Okay.
That's it.
And which are the usual underlying reasons that prompt individuals to do this, to self-injury?
Right. Let's think of a theoretical model, and this has been very well studied. So we have two reinforcement. Intrapersonal, your own reinforcement, and social. Interpersonal reinforcement. So, and we have both negative and positives. So the negative reinforcement of this behavior, for one, will be what is the behavior means for you. Like, for example, reducing the emotional distress, which is probably the main reason for this, emotional regulation. But it also has a positive interpersonal reinforcement, and that is, some people say, I want to feel something, even if it is pain. So this is a desired behavior, right? With respect with the social reinforcement, the negative would be this behavior means you can avoid unwanted social situations. Like, for instance, this student is allowed to be at home instead of having to go to school every single day, right? And the positive social reinforcement would be people will be supporting you. You are calling their attention. They will be with you. They will probably stay with you, right? Apart from that, what we know. So most people use it as a way of emotional regulation. how they deal with negative emotions, they deal with them self-injuring.
Okay.
That's a problem. We also have some other factors, which is very easy to see. Some of them, some others are not. Very important, self-criticism.
Okay.
People say self-hatred, even self-disgust. Not a good idea for this. Implicit identification. People even eventually identify themselves with the behavior. So they do it all the time, right? All this psychopathology we talk about, all these psychiatric problems, let's remember a very important figure that in psychiatric teenager patients, the number of them who do this behavior is from 50 to 75%.
That's a lot.
That's a lot. Really a lot. That means
That's a lot.
2/3.
Yeah.
Almost everybody,
Yeah.
more than 2/3.
Yes. Totally.
Other people. So we said all this psychopathology, the identification, but also social factors. Not only being victim of bullying or cyberbullying, which is also a factor, or this stressful life experience in others, but also a social contagion. It's quite important. These fads, this can even become a fad, and that is a danger. Very, very risky. If it is a fad, I do it because I have seen my friend do it. And it kind of acquires quite a halo of, well, no.
Yes, like you saw it and you want to do it as well, yeah.
So beware of fads in that sense, right? So those are the factors mainly, but remember, emotional regulation.
Okay. And then how can we understand the emotional connection between the psychological distress and the self-injury? How can we do it?
Thinking in those terms.
Okay.
I am feeling emotionally distressed. I'm in pain, psychological pain. I want to change that. So I self-injury, and that pain, that physical pain, substitutes emotional. And it helps me cope with that negative emotion I'm feeling in a way that I get addicted to it.
Okay.
And I do it all the time because it does. Also, for many people, it is a way of self-punishment because there's such a low self-esteem that they say, hey, I deserve this. And it is a way of atoning for some, I don't know what. And that is the connection between the distress and the injury.
Okay, interesting to know that. And what is the best way to address them?
It is pretty important. The attitude of parents, friends,
close people.
The peers. And it is difficult because you have to keep a balanced approach, kind of a middle ground. It is not a crime. It is not a suicide attempt. So it shouldn't elicit such an urgent and severe response. But we cannot trivialize it. It is not banal. It's not trivial. That's important. So we have to try to keep in the middle ground and take it as it is. It is a distress signal. They're calling for help.
And what is the best way to treat them? How can they be treated?
I think the most important thing would be to evaluate them.
Evaluate.
Yeah, first thing. What is this? What we are dealing with? Seek help. So evaluate them, and then let the expert psychologist, psychiatrist, depending on what else, decide what to do with them. Let's remember, even if we are painting a very negative picture of this, because it's important, it's good to know. But like 50% of people who engage in self-injury just do it once and never repeat again. So for those people, really, they don't need much. This kind of approach by the others, understanding, saying, and that's it. The ones that are really important, the ones that repeat, and repeat and repeat and repeat all the time.
Okay. And to finish, which advice would you offer to a relative or a friend or a family member of someone who is suffering or who is doing this self-injury? What is the best way to, from that position, help them?
Seek help. I would say yes, seek help.
Professional, no?
This is not normal. This is not a fad. This is not something that everybody does at a point in life. No. Okay. No way. Seek help, because there are much more adaptive strategies to cope with the stress. Okay. There are much better things you could be doing. And there is this risk of finally going to suicide, from self-injury to suicide, which is not nice. So I would say seek help.
Yes. Go to a professional person that knows how to cope with this, how to face it, how to deal with it.
See what is underlying it. Maybe a psychiatric disorder, no problem. We treat that, of course. So if not, we can treat self-injury as such. Psychotherapy will help. Go for it. Seek help.
Perfect. Thank you very much, Alicia, for all the information, and hope if someone is suffering from this, or a friend or family knows someone, hope this information will help them.
I do hope so.
Thank you very much. Bye. And thank you for listening.